Hi, this is Bob Hall from APTA Private Practice and the State Payment Advocacy Resource Consortium. I wanted to just make a point here on a video on some of the implications of U.S. healthcare spending, which reached roughly $5.3 trillion in 2024, and it was about 18% of the entire U.S. economy. Those numbers come from the Center for Medicare and Medicaid Services Office of the Actuary. They're not just interesting statistics, though. They're the figures payers, regulators, and policymakers rely on when they justify tighter utilization management, expanded prioritization, and continued restraint on provider payments. CMS attributed the recent acceleration in healthcare spending primarily to increased utilization and increased intensity of service, and that framing matters. It's intentionally broad, and it rarely distinguishes, unfortunately, between services that drive downstream costs, growth, and services that help avoid it, like physical therapy. When national spending rises on healthcare, payers don't selectively respond only to the most expensive settings of care, unfortunately. They apply utilization controls widely, and physical therapy is frequently caught in that net. This is why private practice physical therapists experience a growing disconnect. National spending continues to rise, but therapy payment remains flat or actually lags in terms of inflation. At the same time, we're seeing administrative burdens increase. APTA has a great new survey that shows that this is over the 3 times that they've done the survey, only gotten worse. That survey shows that prior authorization has expanded, documentation expectations have grown, and denials become more common. From the payer's perspective, this is what they consider cost containment. From the patient's perspective and the provider's perspective in particular, it just means more time spent navigating bureaucracy. And unfortunately, for PTs, that means less time that they can spend with patients. But what's missing from that equation is the role physical therapy plays in controlling costs across the system. PT is not a primary driver of healthcare inflation at all. In many cases, it functions as a conservative first-line care that actually reduces downstream spending, and I think every single PT knows this. Timely access to physical therapy can help avoid unnecessary imaging, delay or prevent surgery, and reduce long-term disability. And it also can speed the return to work and daily function, meaning that folks can be more productive in their jobs and create more GDP. Those outcomes directly address the utilization and intensity concerns CMS is highlighting, but they're rarely reflected in blunt utilization management tools that we fight against all the time. This is where your advocacy and the advocacy of APTA, private practice, and Spark becomes essential. Much of the payer behavior that affects physical therapy is shaped at the state level. Medicaid payment policy, commercial prior authorization rules, utilization review standards, and network requirements are largely regulated by the states. National CMS data sets the macro context, but state policy determines how that context is translated into real-world clinics real-world rules that clinics and patients live with every day. That's why coordinated state-level advocacy matters. Efforts like Spark exist to connect national spending data with state-specific action, focusing on that action piece. Large-scale data explains why payers behave the way they do, but your practice-level experience explains why those behaviors clearly are missing the mark. Together, they form a credible case for reform that goes beyond anecdotes or complaints, and hopefully will drive some payer behavior to improve. For individual practices, this environment reinforces the importance of participation. Tracking outcomes, documenting functional improvement, and identifying avoided downstream costs are not just internal quality measures. They are advocacy tools. When those data points are shared collectively, they help counter the assumption that restricting physical therapy access is an effective response to rising healthcare spending. Again, at $5.3 trillion, it's just an astounding amount, national healthcare spending guarantees continued scrutiny. Administrative controls aren't going away. The real question is whether PT will continue to be treated as a utilization problem or whether payers will recognize it as part of the solution. That outcome depends on whether we define the value of PT clearly, consistently, and collectively, and whether we engage in advocacy necessary to make that value visible in a system under pressure. Thanks so much for watching, and we'll be doing more of these videos, hopefully explaining things that are happening in the healthcare ecosystem.